Welcome to the Jali podcast. I'm your host, Melyssa Barrett. This podcast is for those who are interested in the conversation around equity, diversity, and inclusion. Each week, I'll be interviewing a guest who has something special to share or is actively part of building solutions in the space. Let's get started. Vena Ford has served as Director, Community Marketplace and Member Engagement since February 2021. She's responsible for the marketing and creative strategy, Medi-Cal membership and onboarding changes in Medi-Cal benefits for Health Plan of San Joaquin. She's also charged with the development and implementation of a community engagement strategy that is aligned with the upcoming California Advancing and Innovating Medi-Cal, or CalAIM, initiative. It's an ongoing priority for Governor Gavin Newsom and currently in development by California's Health and Human Services Agency. She's an experienced healthcare leader. She was at Kaiser Foundation Health Plan of the Northwest in Portland, Oregon, where she was the Medicaid and Charitable Healthcare Operations Manager, overseeing daily operations for Medicaid contracts in Oregon as well as Washington State. She also managed the Child Health Program Plus, a charitable program focused on children not eligible for subsidized health insurance. And in addition to building strong internal partnerships at Kaiser, she collaborated with external partners throughout the region to promote health education and community health among Oregon's most vulnerable populations. She was instrumental, in fact, as a member of the team that implemented Oregon's Cover All Kids program in extending healthcare benefits to all children ages 0 to 19. Previously, she was a professional in community health and a nonprofit manager, including serving for several years as Director of Health Equity and African American Disparities Elimination Project for Solano County in California. The initial project implementation she led continues to address the poor health outcome of Solano County's African American community. She holds a master's degree in nonprofit administration from the University of San Francisco and an undergraduate degree in health education with an emphasis in health policy and chemistry from San Francisco State University. She's been honored as a 2019 Alumni of Leadership Portland and a New Generation Leader of Color Fellow, a collaboration of the California Endowment and Compass Point. At Health Plan of San Joaquin, she's been instrumental in the creation of the Diversity, Equity, and Inclusion Committee, which is charged with developing strategies and plans to promote equity and inclusion that involves their health plan members, providers, community partners, and staff. I am so excited again this week. I say this every week. I'm excited because I get to meet and talk to such wonderful people. And this week is no exception. So we have Vena Ford, and I am so glad that you have joined me on the Jali podcast. So I just want to start out because I know I'm just going to dive in. And with all that you do with, the connection to the community, the marketplace, member engagement, I am just trying to figure out, how did you even get in this space to do what you do?
Oh, interesting. So initially, I think I was about maybe 12 or 13. And remember the Essence magazine before this new renewal?
Oh, yeah.
And so read the Essence and the Ebony magazine. They would come in our mail every month. And I think it was in 8th grade. So I had to be about 12, 13. And I was reading the magazine. It was the magazine in which they highlight all the historically Black colleges and universities. And as I was reading it, I was just so initially from 8th grade, I was going to go to school to be a cardiologist. I had moved my path. I was going to Fisk, and I was going to be a world-renowned cardiologist. And then I went to college and did some work in the cardiology ward and was really sad. It's a lot of bad work, not bad in that they don't save lives, but it's just, the truth. The truth hurts sometimes. And so I was like, well, wait, how can I figure out a way to get upstream and educate people on how to be healthy so they don't have to get to, at 40 years old, having those bad outcomes. So I moved back to California. I was in New Orleans at school and moved back to California and had a conversation with a school advisor. And the school advisor said to me, hey, what about health education, health policy, and all of that? I was like, but I'm halfway through my chemistry program. And he said, I think you have a passion for more, upstream work, more administrative and more of this than just sitting in a lab working with people who are sad. So I enrolled myself into the health education department at San Francisco State and graduated, did some various projects all of the time. And I was working for the airline and I went to AmeriCorps. I spent 2 years in AmeriCorps in central Indianapolis, in the Mary side of Indianapolis in Indiana. I'm working on basically just community development work and supporting people to earn assets through the National Individual Development Account Program. And from there, I took a job at United Way of the Bay Area. And because I had such a great health background, I was lucky to be named the program officer for the health issue, which really supporting granting and providing grants from the dollars raised to the community. But at the same time, we were on the, cutting edge of policy of what is now our modern Medi-Cal program here in California, and then just Medicaid across the country, which is really exciting. So I took that job and then took another job working on health disparities in the African American community, where it was a combination of working with hospitals and clinics and boards and counties and public health departments and all these amazing people to improve the lives of African Americans in the community through health. But it always got back down to people's access. And so in 2010, when Obama passed the Affordable Care Act, or also known popularized as Obamacare, I was super excited. That was my favorite day. It was one of my favorite days of my life. And then a couple of days later, I lost my job. And I was like, well, what do I want to do? I didn't lose my job because of bad things, but I lost my job. So I was like, well, where do I want to go?
Yeah.
And at that point, I realized that I wanted to go into healthcare, and particularly to support folks where they need it, not necessarily at the bedside, but outside of the bedside. So long story short, from there, I ended up working in Portland, Oregon, on the Medicaid program in Oregon called Oregon Health Plan, as a member of one of the organizations that provided care. And I loved everything about it. I was lucky to have an infrastructure that gave me access from everything from eligibility and learning how people got into the Medicaid program, managing that with our own organization, all the way to financial reporting and reporting to the states and all the regulatory requirements and people and systems and all of that in between. And in that time, I spent a lot of time being curious. But also at the same time, I was running and supporting a community program that provided 100% health insurance for undocumented children in the Metro Portland area, which was really great because now I not only have all this administrative background, but I also had a huge community responsibility, which was a lot of fun for me, and did a lot of things in the community up there. Got to know some of the most amazing people I ever worked with. And everywhere I worked in the country, I will have to say, shout out to my folks in Portland. You guys are doing some things. I know it seems hard sometimes, but you're doing some great stuff. And then got recruited here after a short time in Texas, which was an interesting perspective. But was recruited here, and my job here was to be a consultant on what we now call CalAIM, California Advancing in the Innovation of Medicaid, which is the big initiative that our governor I put out there. And then another role came up, and I was asked to do the role as the director of community marketplace and member engagement. So I kind of had all the roles, and then now I get the fun role of being kind of in marketing, which is very interesting with the health education background and a chemistry background to work in marketing. And so I was
like, that's exciting because, you kind of get to see it all.
It is exciting, but it also helps to put perspective on what we're saying, right? Understanding everything that goes on behind the scenes, or most of it. I never say I understand.
Yeah.
But understanding most of what goes on behind the scenes gets you to make to deliver the right message and make people excited about what we're doing and how we're working in the community and wanting to bring us to the table as partners. The health plan has been here for over 27 years and has done some amazing work in this community. And as the community grows, the health plan grows, it's transformed, it's in constant transformation. As Medicaid, national and Medi-Cal in our state is also transforming.
Yeah. Well, and it's so funny. You said, I can't remember the exact term, but you said something about innovation in Medicare. And I was like, those are two words you don't normally hear together. But it's wonderful when you actually have innovation and can see it, because you guys are really, when we talk about DEI, and me, everything to me has a DEI component to it. And I love the fact that you guys actually walk the talk at Health Plan of San Joaquin by actually connecting with the community in ways that most companies don't really get it. And so I love the fact that, and clearly to me, because you have such a broad experience, you guys what you're doing. So before I get to Health Plan of San Joaquin, because I do want you to talk about, like what you guys are doing and all of those things. But I know you also said you had background in, some things like accessing healthcare for the African-American community and, some of those challenges and issues that become more emphasized when we're talking about what zip code you live in and all of those things. So maybe you can just shed a little bit of light on some of the social determinants of health and some of the challenges that we have. And then, we can kind of shift into what Health Plan is doing, because I know you guys are addressing a lot of it.
Yeah. So, I'm of the belief that good health provides a great life, right?
Absolutely.
And so when we have good health, whatever that good health feels and looks like for you, we're able to do things that we never thought we could do. But when you don't have good health, you're always distracted by that pain or that ache or that uncomfortable place. And so in the African-American community, before the Affordable Care Act, Medicaid was typically for the poorest of the poorest, women and children. And also it excluded folks like single men, some working families, people with assets like a home and other assets. And the Affordable Care Act really lifted some of that. So one of the biggest things that happened as a result of the Affordable Care Act, not only just the African-American community, but in the African-American community, is that men got access, low-income men were able to access healthcare. For example, here's an example. When I was in Oregon, so I started in Oregon right when everything was hyped up and everything was moving towards that 2015. I remember calling, which is our president, over dental. I just kind of sent him a message. He was like, hey, you think dental would want to come to the African-American Health Day that was hosted by their huge African-American health initiative in Oregon. And he was like, yeah, we'll do it. We'll do it. That's fine. We'll do it. And we organized and whatnot. And I remember a man coming in a lot of pain. He had never been to the dentist and he was in a lot of pain. So he came in, got an appointment. He walked over across the street to the dental office and walked in, and they got a chair and they were like, oh my gosh, you've got to have all this work done. I'm not going into the extent of the work. And he's like, I can't pay for it. I just can't pay for it. And at that moment, we were able to connect him with folks locally to get him enrolled. He actually qualified for a Medicaid program, which then covered all of his services that he needed to get him back in place. Now, who knows? We know that our mouths dictate the health of our body.
Oh,
so, if your teeth are bad, your heart might be bad, you might have diabetes. There's a lot of things that come if we don't take care of our teeth. But I think in my mind, after him coming over and thanking us for just having the event, I hope, and I still hope to this day, because I didn't follow his patient, I can't follow him. But I hope in my mind, it changed his life. You know, the fact that he had all this stuff going on and he really needed support. And then to find out that it's covered, and then to find out that you can qualify for health insurance is amazing. And a lot of us as African Americans don't know that, you may qualify. You may have a family of, say, 6, and then you and your husband or you and your partner that's to work health insurance and to cover the rest of your family, your children, your surrogate children, your adopted children, what have you, may qualify for Medi-Cal. Because for kids, they actually expand the FPL, the federal poverty level, the money that you make in order to give people access. So, for adults, it's like 138% of the federal poverty level. That's nothing. That's like, I think it's about $14,000 or $15,000 a year for an individual. But for a family, for a kid, it goes up to like 205%. I think in California and other states, it goes as high as 250%. And so a family who might be making a somewhat livable wage, because of the number of families, the number of people in the family, might qualify for healthcare, might qualify for Medi-Cal. It's nothing to be ashamed of. It's nothing to be embarrassed about, because we pay into it all the time, right?
Right.
It's, that's one of the pieces of education we have to give people all the time, is that even though you're both working, you may still qualify, and your children may be on Medi-Cal and you may have your work insurance, or you may be on Medi-Cal and your husband has, or your wife or your partner has their health insurance, but the rest of the family may qualify. We have lots of mixed families. And what I mean by mixed families is mixed covered families in the community.
Yes.
It's as if people don't understand to ask the question. And especially in our community, and I think and when I say our community, I mean Black community, I think sometimes the information just never gets there. And we got to really work hard at getting the information. But I also believe, I had a great teacher when I was at San Francisco State, that I believe in grassroots organizing. It takes us to tell us the right thing to do. So we who have access to that information have to make ourselves available. And that's why oftentimes you see me in the community, I'm working on weekends or showing up at events, or my phone's ringing, both my personal phone at work. So, because I consider myself as having access and trying to be, as one of my previous friends called me, an oracle to connect people. Yes. And so, once we do that, we need to get this information in our churches. We need to get them in our childcare places, of places where we live, on the baseball field, the basketball court, wherever the kids are, in the schools. We need to share this information, and we need to also understand that we need to share the information in a way that people can absorb it and it doesn't go over their head, and they know they have access to it. So I think, in my perspective, now other people may not feel this way, but the Affordable Care Act really got us to got us closer to universal health care where everyone has access. And it also got us closer, or is getting us closer. I won't say it's totally got us there, but giving people opportunities to level up, to give themselves the opportunity to grow. So if I know in California, they're trying to connect all the systems. If you qualify for this, you may qualify for food subsidies. You may qualify for housing subsidies. And while we see those as bad in some instances, I think sometimes our media distorts that for us with people.
Yeah.
A lot of folks have used these programs, have used the programs to step themselves up and to provide support for the load that they're carrying in order to get to the next place where the load might be a little bit light. So,
yeah. Wow.
I hope that answered your question.
Yeah. Yeah. No, it's awesome. I mean, you're dropping all sorts of little nuggets as you go. I'm still on curious. And I'm like, oh, she's got mentorship and curiosity. And so let me flip to Health Plan of San Joaquin, because I think you mentioned Medi-Cal as what, so, for folks that may not be in the United States or California, that is what the state provides, and then we have the national program, Medicaid. But Health Plan of San Joaquin is really focused on the county. And so maybe you can talk about like what they do and, why they exist and are doing the wonderful things that they are. Because I think when we have companies really focusing on delivering products and services to communities that need it, and I mean everyone in the community, inclusive, then you really see the impact of that work in a different way.
Yeah, so Health Plan of San Joaquin is a pretty amazing organization. And I'm not just saying, but it is an amazing organization. It started back in 1996. So yeah, we're close to 28 years old. We're not baby anymore organization. But what it does, it's a managed care organization, also known as MCO. You'll also hear in the Medicaid space other things like ACOs, accountable care workers, CCOs, coordinated care. Well, you'll hear all these things. Always ask questions when people know those acronyms. That's the MCO, the Managed Care Organization, is a locally owned and locally run health plan, particularly right now and specifically for Medi-Cal members. So what we do is similar to what a commercial plan would do, but the difference is you're not paying us to manage your care. We contract with the state, who also has a contract with the feds. They match money, and then they pool the money in order to pay for health insurance for the most vulnerable. But we work in tandem with Department Health Services, DHCS, Department of Healthcare Services, excuse me, and get me if I didn't say the C. They're really working with them to provide to our most vulnerable folks who are at those federal poverty levels that I talked about, access to quality and affordable health insurance. So, typically in the past, we've had programs in California like Healthy Families, which kind of had a sliding scale for children who didn't meet Medi-Cal. That's why they expanded the qualifications for children as those two programs combined. But really what Health Plan does is make sure that we partner with the county, with all of our county agencies. We partner with CBOs, community-based organizations. We partner with clinics, both federally qualified and other clinics, as well as hospitals that are in our community and individual providers who want to work with us to provide health insurance for them to go see all these folks to receive care, right? So we're basically that middle person between the state providing a program and our providers or organizations providing the care to manage and make sure it gets paid for, make sure it meets the regulatory requirements or the state requirements, and then also to support and to help with any challenges that may come up in access or connection, whatever that looks like. And that's from a simple place. Now, the contract, like over 200 pages and all these other things we have to do.
Right.
But from a simple perspective, we really are the middle person that works with our providers, our communities, our child beings, our dental partners, our mental health partners, to make sure people have access to what they need when they need it in good quality and on time.
Let's pause for a moment. We'll be right back. Well, and since you mentioned mental health,
yes,
and it's Mental Health Awareness Month.
It is.
So, because I think a lot of people maybe don't know that Health Plan San Joaquin even provides for mental health. I mean, you think medical, okay, I go to the hospital, or, I need to go to the doctor, maybe the dentist, but now you're talking about mental health. Is that new?
Nope. It has never not been new. So, and what's happening with CalAIM, we talked about the innovation project that the state is kind of embarking on, is that it's starting to bring all this together to address, I think we didn't talk about, but social determinants of health, right?
Right.
So, what are the social determinants that make you healthy? And then where we lack them, how do we find the supports to get you there? Mental health has always been there. Mental health, I think sometimes we disconnect our mental health from our physical health, and we disconnect our oral health from our physical and our mental health. I know if my teeth hurt, I can't think.
Yeah.
We always disconnect our body parts, or we disconnect things. But when we walk around, we're a whole person, right? So mental health being offered. So the plan has a partnership with the mental health provider to do basic mental health. And then anything specialty or high grade would go to county mental health. They have a contract to do that work for our members. But really, if someone needs support, whether it's counseling or others need assessments done, all those things around mental health or the health of their mental state, yeah, the plan offers it. I mean, most health insurance do offer some sort of mental health program. They're a little hard to navigate sometimes, but luckily with the plan, you can just pick up the phone and we'll connect you with our provider, and they will definitely move people forward. And the other thing about that, it does go underutilized because there's still a lot of, how do we say, misbelief, shame, misunderstanding,
stigma,
when it comes to accessing mental health or a provider or counseling, group counseling, whatever it may be. But we, especially as brown people, especially as Black people, we always say, "Oh, I'm gonna give it to God." I always believe there's a place in the Bible. It said, I know it's highlighted for me, got a bookmark and everything. God said, faith without works is dead. Sometimes we got to do the work on ourselves to help the faith. And that goes for our mental health too, right? It's not enough to just give it to God and expect Him to change everything. We've got to do some things for ourselves, whether it's changing our diet, changing our environment, changing the way we think. But how can you do that if you don't have the tools? That's why you seek providers, counselors, support to give you those tools and to help you find ways to figure it out at the same time with your prayer and your meditation and all of those things that you do.
Yeah, that's awesome. So bringing it back, just because I know we didn't talk really about the social determinants of health. So, what is that first? Maybe you can just tell us
So I'm gonna say it in the simple form. I know if the folks I work with, they'll be like, "What?"
Just give it
It's
to
so
it in real talk.
complicated.
Real talk.
Yeah, it's real talk. It's like so hard. It's very complicated. So social determinants of health are what are those things that are around you that determine your health? Your housing, your education, your access to jobs, how you grow up. If you grow up in an abusive situation, if you grow up in a loving situation, a lot of things, those things that we don't think about when we talk about health, right? Like who thinks about the route from school to home as determining if you're healthy or not, right?
Yeah.
Not a lot of people. They just walk home from school. I remember I was a kid. I just walked home for school. It wasn't until I was an adult I had to sit back and think about that. I was like,
what did you get through?
Right. The things you have to go through, the people you encounter, the folks the things that are said to you, the stuff that you see, those really affect, those social determinants. And I mean, they're very prescriptive. They're very, there's 13, or 12 of them. And I usually say the one that's missing is racism, because oftentimes, we might want to add bullying too, right? And those things have a huge impact on who we are. Can you eat 3 square meals a day, right? That's part of it. And, if hunger as a determinant affects your health, there you go, right? Yeah. Education, hunger, access, housing, food, racism, it's all there.
Yeah.
In its simplest form, it's all the things that you do outside of the clinic. That's how I put it, right? It's everything else in life. Do you have a car? How do you access where you need to go? Why are you late to work every day? Because I have to walk. Some days I'm tired.
Through the snow. Remember your dad used to tell you that?
Right. But the reality is that what is around us, what impacts us is literally around us. And if you can change those environments over time, those environments over time start to hopefully improve the health of the people that are within it.
Yeah. And that's why I love Health Plan San Joaquin. And I'm not just saying it either, but truly, y'all are walking the talk, because, I mean, we see you, not only you, but the team really out in the community, touching people, making a difference, showing up. I mean, because I think a lot of times people don't even know who to call, where to call. The fact that you guys sit in the middle, I think, is really helpful, because I think there's a lot of people, even in my own household, that, are trying to figure out healthcare. You know what I mean? And it's like, it's a challenge. I mean, literally, I think when people think about whether they're retiring or whatever they're doing in life, healthcare is like one of those things that can make or break you, because, it's expensive.
But healthcare should be a right, not a privilege.
Yeah.
And that's really, and I've forgotten to say that. I don't know, I know the Martin Luther King, the highest form of injustice is injustice in healthcare. But I don't know who said healthcare should be a right, not a privilege. And oftentimes, when we're thinking of our budgets, right, we're thinking of what we got to do. Health insurance is the last thing. It's the last thing we think about, because it's so expensive. And in the moment, you might be healthy, but tomorrow something may come. And it's the last thing we think about, especially when we're young, right? We're invincible. You can't tell me I'm getting sick, right? And there have been times where I see tragedies happen and had to step in because folks needed health insurance because of a tragedy, because the person wasn't prepared. And it's really about preparing, right? It's about preparing ourselves for what may come or what may stay. But we, oftentimes treat healthcare as a privilege, when really it should be our right to be healthy, our right to have a safe environment, our right to have housing, our right to have, healthy foods. And, there are policies and things in place, and I'm not going to get political because that's a whole other podcast we get into. But
Right.
there are things in place that, oftentimes we talk about, well, why can't we change this? Because we have policies in place that are preventing us from changing. We've got to change that first in order to get to what we need. And so, and many of these policies have been, generations, and they weren't written thinking about us today with all of the technology, the access. The fact that you can pick up the phone and have a whole conversation and appointment with your doctor now from the comfort of your couch or bed is amazing, right? So that's how many times I did not go to the clinic because I could just handle it at home.
Right.
But those are the things that we have to teach people. And especially, getting back to kind of health plan and Medi-Cal members, they have access to this stuff. They have access to telehealth. They have access to mental health. They have access to dental and eyeglasses in certain instances. And, early pregnancy coverage, thinking about not only is May Mental Health Month, but we just left maternal child health month, right?
Yeah.
And we have a lot of babies and families that are low weight or coming out with issues because mamas and papas didn't know that they could access care in this kind of way. And once they get the access, it might be too late or it might be, down the road. And so what we've got to do is just keep the messaging. That's why our staff is everywhere, right? And that's why Health Plan of San Joaquin is trying to be everywhere. It's just, we don't care who you decide to go with. But for us, it's more about the message. You have a right. Healthcare is a right. And here's your opportunity to get that with whomever, whether it's a commercial plan, whether you pay for it yourself or you go through Medi-Cal. You deserve to be healthy. We all deserve to be healthy.
I love that. Yes, indeed. Well, and so, some of the stuff you hit on, we were talking a little bit about healthcare, and financial wellness even. And, sometimes when we're stressed out, when we don't have money, and then we go to the doctor and then we're stressed out because it costs so much and we still don't have money. And so it's like this vicious circle of stress and health. And so maybe you can talk a little bit about, because I know you've even given tips and tricks for folks that, I won't call them tricks, but tips for how, if people can't even pay, like what do they do? And, there's so many things that I think people may not know when it comes to healthcare and trying just to get it. So maybe you could talk about the financial components of health and wealth together.
Yeah. Oh, health and wealth. The two of my favorite subjects, health and wealth, because your health determines your wealth. And sometimes your wealth determines your health, right?
Yeah.
So, and you got to have them both aligned in order to get where you go. I'm going to step back to what I said, that having good health should be, it's a requirement. It's not a privilege. It's a right. And so, yes, if people are sick, they should go to the doctor. There are ways to get into the doctor and to not have to pay. There are ways to get into the doctor and have to pay a discount. Always ask for help. That's what I have to say. Medi-Cal members don't really pay for anything, like really nothing, unless they want something elective, which is not covered, which is rare. And those elective things, most of the time, Medi-Cal members can't figure them out. So if you qualify and you can access it, go access it and keep yourself healthy. The one thing I can say is that, one way to lose your wealth is to not have yourself covered and not taking care of yourself, right? And so, people who choose not to, for whatever reason, I'm not putting anybody down, to take health insurance, or to find ways out of it that I was always at risk, right? It's like driving to California without car insurance, right?
Right. Exactly.
You get pulled over and they ask for license and registration and insurance. They don't give up from insurance, right?
Yeah.
So, like, God forbid you get into a car accident. Well, it's the same thing with your health. God forbid you get into an accident or something goes wrong or something happens. It's the insurance on who you are as a healthy person. And so, one way to sustain our community is through programs like Medi-Cal, coupled with programs like, I think it's still called TANF, the Temporary Aid for Needy Families, or whatever the new program is, and EITC, Earned Income Tax Credit. All of these put resources back in the hands of those who are vulnerable of not having what they need when they need it, right? And then at that point, they can use those as stepping stones or not, whatever they decide. But there are opportunities to keep our community healthy, keep it moving forward, keep it economically sound. So, for example, you don't have health insurance, we use teeth because teeth are just so easy, right?
Yeah.
I have a toothache and now I've got a headache and now I can't see, right?
Right.
And I have to go to work and I go to work and I'm irritated and I'm upset. And then I get a bad rap at work or I get written up for something because I'm all in this pain and then I don't have a job. All because I didn't go and handle the tooth. Imagine our babies, right? I was one of those children who didn't know they needed glasses. And the reason why is I got chickenpox so old. And I remember, I was a taller student. I'm not tall now. I'm just simply at that time, I was tall. And so I sat in the back and I couldn't read the board. I could not see the board in Spanish class to save my life. And everything was written on the board. And I was disruptive because I was trying to figure out what things said. So I'm asking people, walking up to the board all the time. And as soon as, my teacher talked to my parents about getting a pair of glasses, I've been wearing glasses in 8th grade. I was able to see again. And that made a huge difference in how I performed and how I was present in the room. Right. And even though after 8th grade, I became the shortest person, I still had access, right? We don't think of things like eyeglasses as access. We think of them as accessories, but no, it's access to a world that I can't see otherwise. A dentist, it's access to the world that I can't chew or taste or even prevent a headache otherwise. Going in for your well check, that's access to the world to be able to perform otherwise. So I really, I also think that health is wealth, right? So if you are healthy, you are wealthy because now you can do anything. You don't have this distraction of your temple being all over the place. Instead, you're invincible. You can do whatever. If you want to go start a $1 million company, you can do it. Or if you want to just ride a bike around Lake Tahoe, you can do it. But your health is definitely your wealth. And from that, the world is your oyster. So health plan, really is focused on getting people to go in for their well person checks. Well child, well women, well man, whatever that looks like for you. It's important to go in. It sounds like an inconvenience. Who likes going to the doctor and they spoke to try it? However, when you come out, they're like, you look amazing. You're healthy. You don't have high blood pressure. Your numbers are good. You can see, you can taste, you can eat. Then you can go and do what you need to do.
And I should mention that in some of these federally qualified healthcare centers, they have some better innovation than some of the other hospitals and doctors' offices sometimes. I mean, it's amazing.
Oh,
Because,
yeah.
I think our mind is thinking that, oh, well, maybe they don't, kind of, they're not the same or they're less than. But the investment the federal government has made in federally qualified healthcare centers is huge. So it's
Yeah.
amazing to see how much service you can actually receive, and better, in some cases, better service, depending on where you are. We have to kind of change our thinking.
Yeah. These aren't your FQHCs of the 60s, right? We're
Right.
like, when FQ started in Mississippi and it was well, I'm not gonna go there, but it was a bunch of black women,
Right.
trying to provide help in rural Mississippi. Um, and they sought funding and got it to actually create these small, communities to support people who are now, no longer sharecroppers, no longer this, no longer that. And now FQs are amazing institutions of care in the community. I'm not saying that our larger plans or don't have access, but they're rooted in the community, kind of like the health plan. They're in the community, they're rooted in the community, they're for the community, by the community. They can react and move with the ebbs and flows of what happens in the community. And so you're right, FQs are not the same
Yeah.
as they have in the past. I remember moving here and I got assigned to an FQ. I was like, wait, what? And I went in and I was like, oh, well, this is not.
This is different, huh?
But I have a commercial plan. And so to get assigned to an FQ seemed very different for me.
Right.
But it took away that misnomer of where to get care. And then also, they have other allowances for people who may not be employed or don't have insurance, which should be very rare now because we are at 95% insured in the state, not more now.
Nice.
But they offer so much, and so much, they're so connected to what the community needs are. This is not to down anybody else, but it's also to uplift
Right.
the innovation, the care, the advancements that, from the 650s and 60s when FQ started in rural Mississippi in the cotton fields out there to today. I mean, technology has
Yes.
taken us so far.
Yes. Shout out. We gotta give
Shout
a
out.
shout out when we need to. We give a
Shout
shout.
out to all of our plants and all of our.
Yes. Yes. We were gonna also talk about renewals and what that even is.
Yes, renewals. Oh my goodness. So, COVID. That's all I have to say. I'm done with it. I don't know if y'all are good as I am with COVID. I want to be outside.
Right?
Right?
Exactly.
But there were a lot of great things as a result of COVID that we learned about ourselves as a country and I think as a world. And there are some things now we got to course correct, right? So one of the great things that happened during COVID is that anyone who was on a Medicaid product across the country did not have to renew starting in, I think it was February or March of 2020, when we all went home. We had to stay at home.
Right.
So folks have been on, we'll just use Medi-Cal, for example, and they've never had to renew during this time. Yeah, they've got letters of renewal, but unless there's some extenuating circumstance, the state wasn't going to term anyone. However, the time has come where renewals are going to relaunch. So on April 1st of 2023, the first letters started to go out. They started in April, and then letters went out early May, and will continue through next June. Letters are going out to Medi-Cal members who have not renewed that must renew. So not everybody has to renew. About 25% of the folks on Medi-Cal don't have to worry about renewing ever. but the rest of them may have to renew in some sort of way. And so in the mail, they'll be receiving an envelope. It might be yellow. It might be vanilla. Today I heard that might be white. I don't know. But you're going to get a big envelope if you're a Medi-Cal member. And in that envelope are those renewal papers. You will have, folks will have 60 days to turn those around. So fill them out, get all the documents together that you're being asked for, and then send them back to the address on their most likely their counties. But another great thing, technology, innovation, is people can actually do renewals online too. So right. They can, I'll have to look up the website, but they can go online and pull up their information. It's in the packet, and pull up their numbers and get the whole application online and submit online. But not every family has access to the renewal process online. So that's why everyone's receiving a paper package. And what I would say is, keeping coverage is important. If you don't have alternative coverage, if you have not applied for alternative coverage and you don't think you qualify for Medi-Cal, or if you know you qualify for Medi-Cal and you're just looking at the package when it comes in the mail, like, what is this big package of stuff? Because we know folks don't open it, fill it out, go online, fill it out. If you need help, call someone, let them help you fill it out and get it back. No one in our communities, nowhere in the United States, should go without health care that can get access to it. So I am excited that people can actually get these packets, get themselves renewal. Now, mind you, before COVID, everyone knew that there was an annual renewal process. All the feds, the federal government and the state governments are doing is reinstating that renewal process. But there in California, there were about 1 million, if not more than 1 million people that were able to access Medi-Cal during COVID that never seen this process before. So they're going to be surprised. So if you see the billboards out there, whether they're a health plan or another organization or the state, Cover California, all of those things, pay attention to them. The ads, I saw the ads are running on television, on his watch TV, and I've seen about 5 times the ads run on Spotify, on Apple Music, on Pandora, the little ads. If you don't have paid, use the free ones. I use the free ones at home. Outside, paid ones at home. The ads are running. I heard the ads. They're all running. It's important to get those packets back. That, again, gets to that your health is your wealth. And not filling out this packet that may take you an hour could be a huge impact and blow to your health. So if I can appeal anybody, if you know anyone on Medi-Cal, if you have anyone on Medi-Cal, if you're a Medi-Cal yourself, or you know people in your church, in your groups, at your school, at your work, who might access Medi-Cal, tell them to get their packets back. Tell them the renewal is important. And there's nothing to be worried about, ashamed about, or anything. Because the great thing in California says, if you don't qualify, here, let's go find something else for you. That's one great thing about our state, is that they don't want to leave anyone behind. So,
yeah, I love it. That's awesome. Well, and you talk about the financial stability and sustainability and success. This is how we do it, is we connect these dots. So I want to give another quick shout out to you and all of my D9 sisters. I know you're an AKA, so I'm gonna give a shout out to the AKAs, even though I'm a Delta. But we are sisters. We are sisters. So I just want to thank you so much for joining me today for this conversation, and just really excited about what you guys are doing. And I know for those of you that will see Health Plan of San Joaquin up in June, that'll be at probably every Juneteenth event. Definitely give them a shout out and come hang out at their tent because I'm sure I'll be close by.
Yes, yeah, I do I want to mention that, especially in the Black communities, the D9, like we love partnering with you all, not just because I'm a member of Alpha Kappa Alpha, but because you all are really great community organizers. You're very close to the community. You're close to providing resources and research and networking opportunities to the community. So I encourage all members of the D9, all organizations in our areas to come together, as well as with all of our association and organizations in the community. And you know, one of the things I learned when I was doing the Disparities Project is anything we do for Black people, everybody. We're such touchy people. We love everyone, and for the most part. And so when you change me, you change my neighbor who might not look like me, but I can now share information with him and his family, or other neighbors who might not look like me and their family. And so I encourage us to step up. We've done a campaign with D9 around COVID. We'll probably look to you all to provide some leadership soon. And yes, we will be at Juneteenth. Stockton, Lathrop, Tracy, and I believe Modesto. So come by our tent, come get some stuff. We will have fans. It's not going to be hot.
Yeah, we're going to need some fans.
Yeah, come play with us. We're going to have, you know, opportunities for children to learn. We're going to have books. We're going to have things out there. But come by and learn a little bit more. Ask the questions. Ask the hard questions. I will say the staff that is there can answer them. And the one great thing is if they can't answer the question, they will take your information and connect you to whomever you need to answer that question. So please come by. If you see me out there, just shout me out. I'll be around. Try to stay cool. And then, you know, if you need anything from us, one of the things we want to do or we continue to do is to make ourselves available to the full community. So we're here for everyone. We're not here for just one group or another. We know that African American health disparities are at an all-time high and our results are all-time low. But there are other communities that have similar, including our counterparts that not are necessarily considered minorities. And one of the things I want to say, at least in our community here, we really need to focus on getting people back to their doctors. I think I said it twice already. I'll say it again. If you know someone, get them back in their doctors. Get women their mammograms. I do mammograms and lunch. Want to go get your mammogram? You want me to drive? I'll buy lunch on me for you to get your mammogram. Make sure men are going in for their checks. Make sure people are, the babies are going in for their immunizations, and that our mamas, our newly pregnant mamas, or go in to the doctor to take care of the well-being of their baby as the baby is growing. And then to learn all the great stuff you don't just know. Having done Maternal Child Health Week or Month and Maternal Health Day, I was intrigued by all the stuff I didn't know. So believe me, I'm intrigued. There's so much for all of us to learn. So it has been my blessing. And on behalf of Health Plan of San Joaquin and our interim director, Everett Hendricks, and our executive staff, I thank you for having us today. And anytime you want us to come and talk, or I could, if not me, I'll always get someone else to do it. We are definitely for the community, by the community, and about the community. So,
awesome.
We're here. We're not going nowhere.
Thank you so much, Vena Ford. You are a treasure, and we appreciate all the work that you and the entire team do. So shout out to the team as well. If I start naming them, I'll probably miss somebody. So I'll just say shout out to the team. But thank you so much for coming, and we look forward to having you come back and talk a little bit more about the impact on the community as well. So I'm looking forward to it. I'm gonna hold you to that.
All right. Thank you.
All right.
Thank you, Jali. Thank
you. My pleasure. Take care.
Alrighty. Bye-bye.
Thanks for joining me on the Jali podcast. Please subscribe so you won't miss an episode. See you next week.
This podcast is a part of the C-Suite Radio Network. For more top business podcasts, visit c-suiteradio.com.